Hi, in this episode we'll be discussing eczema. Eczema, also known as atopic dermatitis, is a common condition that causes inflammation of the skin. It is characterized by a dry, cracked, itchy skin rash. Eczema can affect any patients at any age. However, it's much more common in infants and children. The exact cause of eczema is not fully understood, however there does seem to be a genetic component to eczema, as it tends to run in families. A family history of atopy increases the risk of eczema. Atopy refers to an exaggerated IgE immune response to allergens and is seen in atopic conditions. Examples of atopic conditions are atopic eczema, asthma, and hay fever. So what are the symptoms of eczema? Eczema presents as red, dry, itchy sore patches of skin. Eczema usually affects the flexor surfaces of the body, such as the inside of the elbows and the back of the knees. However, it can also affect the extensor surfaces of the body, as well as other areas of the body such as the face and neck. Patients with eczema experience periods where the condition is well controlled and periods where the eczema has flared up. And so in some patients, eczema can be referred to as a relapsing remitting condition that comes and goes. Eczema is quite common in young patients and may go away as a patient ages. In some patients it goes away completely. Eczema can be classified based on the severity of symptoms, broadly into mild, moderate, and severe. In mild eczema there are areas of dry skin with infrequent itching, with or without small areas of redness. In moderate severity eczema there are areas of dry skin, frequent itching, as well as redness. And in severe eczema there are widespread areas of dry skin, frequent itching, redness, and there may also be oozing, bleeding, and cracking of the skin. There's no specific test to diagnose eczema. The diagnosis is usually made clinically. What are the complications of eczema? The skin normally acts as a barrier to harmful microbes. However, in eczema the skin barrier is broken down, therefore increasing the risk of bacterial skin infections. The most common bacterial infection associated with eczema is caused by the bacterium Staphylococcus aureus. Infected eczema can cause symptoms such as a blistering, oozing type rash, as well as a fever. Treatment of infected eczema is with antibiotics, such as flucloxacillin. Another complication of eczema is a serious viral infection, known as eczema herpeticum. Eczema herpeticum is a serious skin infection caused by the herpes simplex virus. It causes clusters of blisters with a punched-out appearance that spreads rapidly. Patients with eczema herpeticum are usually quite unwell, as it is a life-threatening condition. Eczema herpeticum can affect any patients of any age, however it is more commonly seen in infants and children. The infection is typically treated with antiviral medications such as acyclovir. Let's move on to some treatment options. One of the main treatments of eczema is to avoid triggers. Many individuals will have specific triggers that appear to cause flares of the disease. These can include perfumes, detergents, soaps, and even clothes. And so an important treatment option in patients with eczema is to try and avoid triggers as much as possible. Medical management of eczema involves a stepped approach. The first treatment is with the use of emollients. Emollients are moisturizers that moisturize the skin. They can come in a variety of different forms such as creams, ointments, and lotions. Examples of emollients that you may have heard of are E45 lotion and Epiderm cream. Emollients may also be added to soap substances such as shampoo as well as shower gels. In more severe eczema, topical steroids are used as well as the emollients. Steroids work by dampening down the immune response and therefore reducing inflammation. Steroids come in a variety of strengths from mildly potent such as hydrocortisone to very potent such as clobetasol. Very potent steroids are usually only started by specialist doctors. There is also some side effects to topical steroids to be aware of, such as thinning of the skin, depigmentation, as well as acne. If there is severe, extensive eczema, a short course of oral steroids may be tried. Topical calcineurin inhibitors such as tacrolimus may be given by specialist doctors to treat severe eczema. They are typically used when steroids fail, and they work by dampening down the immune response and therefore reducing inflammation. Atopic eczema normally improves as children grow up. It tends to gradually resolve and go away completely in around 75% of patients by the age of 16. Unfortunately, some patients will still be affected well into adulthood, and the condition may even worsen as they grow older.